Welcome to Stalk Physio ABC of Conditions. My name is Wendy Emerson, I'm a consultant physiotherapist, and this is Matthew Barnaby, who is a specialist clinical physiotherapist here. What we're going to talk about is carpal tunnel syndrome. You may have heard of it, but it's a condition that affects the hand, and you get pins and needles, tingling, numbness, weakness even into this side of the hand, and it's thought to be caused by the nerve that goes under this piece of tissue here getting trapped. So it becomes swollen, it doesn't transmit properly, and this is what causes the signs and symptoms. The thing is, what we now know is that pain always goes down, it doesn't come up. So if you also have pain coming up the arm, then it cannot be coming from the wrist. And we're going to show you, going through an examination technique of how to decide whether it's the nerve being pinched at the wrist or at the neck.
So often we get patients come in complaining of pain on this side of the hand. Now, if it's true carpal tunnel syndrome, your symptoms will all be on this side of the hand. And like I said, more often than not, patients are misdiagnosed this. And what we're going to go on to later on in the video is to actually explain to you how we can differentiate between something that is actually carpal tunnel syndrome or if it is actually something else other than that's coming off of the nerves.
Yeah, because what's the main point about this is that the median nerve coming through here, it supplies the thumb, that finger, and half of the ring finger, interestingly enough. There's another nerve called the ulnar nerve that comes through here that supplies the little finger and the other half of that finger, but it doesn't go through the carpal tunnel. And as Matt said, where a patient's got pain coming through on the back of the hand, it's another nerve altogether that again doesn't go through the carpal tunnel. So it can't be carpal tunnel syndrome. So for the purposes of this demonstration, I cannot emphasise enough how important these tests are. Matt's going to be the patient, but I'd ask you to remember that standard medical treatment for carpal tunnel, as it's been understood for a while now, is drugs, analgesics, anti-inflammatories, to deal with what they think is the inflammation caused at the wrist. If that doesn't work, then it's surgery. So what they do is they cut a piece of tissue that sits across the wrist there to hopefully release the pressure on the nerve. But the important point is the diagnosis. We have to make the right diagnosis, and then treatment is easy. So, for this test, what I'm going to do is to put a stretch onto the nerve that comes from the middle section of the neck. It comes down over the first rib, under the collarbone, comes into the arm, down through here, through the middle of the arm here, and it goes into the wrist, as we've said before. So, initially I'm going to put pressure from the shoulder to the neck. So I'm putting a stretch right there on the nerve. So I'm holding that. Then what I'm going to do is to stretch the nerve right out into that position. Now, if that causes pain, pins and needles, tingling, all of this, then we know that there is a problem. Obviously, there is a problem with the nerve. Now, I'm going to hold that position of the arm, but I'm going to release the pressure on the shoulder. So I've taken the stretch off the nerve only from the neck to the shoulder. If that then releases the symptoms into the hand, then we know definitely it's coming from the neck. And to go back into that as a double check, I'm going to put the pressure back on, and back come the symptoms. Take it off, and they go away. So we know it cannot be coming from the neck. It has to be coming from, we know it's not coming from the wrist. It is absolutely coming from the neck.
So now Wendy's going to play the role of the patient, and I want to show you a part examination of how we assess the neck. Okay, so first of all we get the patient to sit up with some good posture. Okay, so here we're going just to assess right rotation. I'll put a bit of overpressure on there. Ask the patient how that feels throughout range of movement, and then we're going to go over to the left side. Okay. We're also going to look at side flexion. Okay, and then we're going to look the other way. Now it's important to put the hand on the shoulder to reduce any accessory movements. We then ask the patient to look up. Good, and we ask the patient to look up and over to the left. We do the same, looking up and over to the right. And during all of these movements, what we're looking for is, and asking the patient, is if there's any difference in pain, range of movement, any stiffness, and more importantly, if it produces any of the symptoms that they currently have into the wrist.
Matt's gone back to being the patient now because I thought it would help if I showed you how we treat this. Because what we've got to do is to clear the block in the small joint on the side of the neck that is actually causing compression on the nerve, which in turn is causing the problem down into the hand. So one technique that we use, and there are many that we have, is called manipulation. And manipulation is a high velocity thrust technique which quickly gaps the joint and restores the range of movement. We then add in other techniques. We can use interferential therapy, all sorts of things, to then settle those joints down, and we use the test that we did, the upper limb test, as a home exercise, so you gradually get the length of the nerve back again, and then all the symptoms will subside. But back to manipulation, what we do, and it's a very specialised and specialist technique, is I'm going to take it there, I'm going to find where the block is, into there, right into that point. I've got that as a pivot. We go round, wind it down to the block, and then it's a small little movement after that. It's not a big terrible movement. There may be clicking, there may be all sorts of things like that, but the idea is to regain that movement within the joint of the neck, and it's a very quick way to do it. If we can't manipulate because somebody may be osteoporotic, all sorts of other reasons, then we can do a thing called mobilizations, which is a gentle movement that will restore that range of movement, or even straightforward manual traction, which is where we come into here and we just stretch those joints and loosen them off. But what we're trying to do is to restore the mechanical movement within the neck, settle down the inflammation, and then get the full length of stretch on the nerve itself. None of this requires drugs. What I'd ask you to remember, though, is the techniques we've just shown you are seriously specialist techniques that we learned postgraduate and are not to be tried at home. There are a lot of problems that could go wrong in the neck. Please do not do that. If you need advice, then come and see us on our free assessment scheme.
And yeah, I need just to follow on from that, if you do want any more information on carpal tunnel syndrome, or if indeed you think you may have carpal tunnel syndrome when you're not sure, please give us a call. You can phone in reception, you can visit us on the website, but do give us a call.
That's what we're here for. Thank you for watching. Next time we're going to be talking about D for dysmenorrhea, otherwise known as painful periods.